Hi there, Doc Davis, orthopedic neck and spine specialist. Here's what you need to know about cervical radiculopathy. Cervical radiculopathy is a condition that results from a pinched nerve in your neck. There are 8 nerve roots that exit out the neck going down the shoulder, upper back, and arm. If one of these nerves gets pinched, you can get pain, numbness, tingling, or muscle weakness that runs along the distribution of that nerve root. The 3 most common reasons for a pinched nerve in the neck are when a disc herniates and pushes on a nerve, if a bone spur pushes on a nerve, or if the spine is out of alignment, trapping the nerve, placing pressure on it. If you develop a pinched nerve, you can have pain, numbness, tingling, or weakness, or some combination of those symptoms. You can experience pain anywhere from the neck, in between the shoulder blades, and out down the arm into the hand or fingers. You can also experience headaches with a pinching of a nerve coming out of the neck. A lot of times you'll notice it at the base of the skull. When a nerve becomes pinched, a lot of patients can experience pain in the neck, and that's the body's way of trying to protect you from twisting and turning your neck, putting additional strain on an already pinched nerve. You may even notice spasms or fasciculations or twitching in the muscles in your neck or upper back, and this is quite common when a nerve is pinched. The 2 most common causes for a pinched nerve in the neck are either herniated disc or degenerative arthritic bone spur. Herniated disc can happen when you go to lift something heavily, where you strain, putting excessive pressure on an intervertebral disc between the vertebrae. It's also quite common to develop a herniated disc over time. Often patients will feel like they just woke up with a pinched nerve, as a herniated disc can happen without any traumatic episode or event. Alternatively, over time, you can develop a calcified disc herniation, which turns into a bone spur, placing pressure on a nerve. Many times patients that have a bone spur that pinches a nerve report a more insidious onset of pain. Sometimes they'll start with just neck stiffness or tightness, and then it can evolve to symptoms of pain, numbness, and tingling shooting down into their arm and hand. Classically, a pinched nerve in the neck will give symptoms from the neck all the way down into the finger along the distribution that the nerve is running. However, in my experience, a high number of patients don't have this classic presentation. Some patients just notice a stabbing, burning, or tightness pain behind their shoulder blade. Sometimes they'll present with neck spasms and tightness. Other times they might just have burning or tingling in their forearm. A pinched nerve in cervical radiculopathy is usually confirmed by MRI or CAT scan imaging. After you're diagnosed with cervical radiculopathy, there are several treatment options. Most treatments are successful without needing surgery. Physical therapy or chiropractic care, along with anti-inflammatory medication, can make the symptoms of cervical radiculopathy resolve in a majority of patients. Occasionally, an epidural steroid injection is helpful to calm down a pinched nerve. Lastly, if symptoms persist for several months, or if there's any progressive pain or weakness, surgical intervention can be highly successful. Surgery to treat a pinched nerve in the neck can be as simple as removing a bone spur. This is called a posterior cervical foraminotomy, which is performed as an outpatient procedure. Commonly, a cervical disc replacement can be performed to treat a pinched nerve in the neck, and this procedure restores normal range of motion in your neck. Occasionally, a fusion procedure is needed if there's significant structural change in the neck associated with a pinched nerve. If you think you have symptoms of cervical radiculopathy, schedule a consultation and I can investigate.